Welcome to This is Jax. Today's guest is Dr. James. She's the founder and CEO of Haven Family Health. I'm so excited to dive into that. We're also going to hear her story, how she went from India to the U.S. and before landing right here in Jacksonville. And today she's digging her roots. She's opened up her own DPC practice. And if you don't know what DPC is, don't worry, we're going to get into it. But it also focuses on affordable health assurance and holistic healthcare options, very near and dear to my heart. So I'm excited to have Dr. James on as a guest. If you're a first-time listener, be sure to subscribe. You don't want to miss any upcoming episodes. Welcome to This is Jax. Welcome to This is Jax, a hyper-local podcast. We're going to do our best. We're going to bring on successful business owners, the people who drive the cities, share a lot about what makes our city so great. So you can be confident and comfortable. This is a city that you want to call home. Dr. James, thank you so much for coming in today.
Thank you for this opportunity.
Yeah, you're welcome. I know we were talking a little bit off camera. Obviously, running your own practice is demanding. So taking the time off, that's valuable. And we really appreciate it. And we can't wait to get into your story.
Of course.
So we'll go ahead and just dive right into it. You know, your journey to medicine, from what you shared with me, was inspired really by your grandfather, right? So how did growing up observing his work kind of shape your passion for health and wellness?
Yeah, so I grew up in India. I was born there and I grew up in our family home. So with my grandma and my grandpa and my mom. My grandfather was a family medicine practitioner and he was one of the few doctors in the area. And I don't know if that concept was here in the US, but in India, the doctors have their clinic in the home. And so it's very common for you to see patients right at your home. So that was my memory growing up, every day waking up just to lines of patients. And my grandfather, he does his morning routine and listening to music, gardening, and he gets into a meditative state and then he goes and sees his patients. And there was no distinguishing factor between family and patients. His patients were his family, and the patients were welcomed into our family. And the same went the other way around. The patients welcomed us into their family. And that's what family medicine is about. I grew up seeing all of that and how beautiful that concept of having a doctor who could do that could be. And that's what inspired me to go into medicine. And I came here, went through medical school, but when I got into residency, things were different. It just didn't have that old school touch anymore.
Okay. So it was like a totally different world, a totally different country, but it also proverbially a totally different world. When was it that you made that move? Was it college? Was it early school?
Sure. So I actually spent a total of about 7 years in India.
Okay.
And the rest of my life I spent in the US, mostly in Chicago. And so I spent middle school, high school here, and I went into medical school here as well. So majority of my life was in the US, but I'd say the best of the childhood years was in India.
Yeah, that's great. And then what was it going from India to Chicago? What was it that led you to Chicago? Was it the schools alone, or did you just pick on the map? How did you know, obviously you were younger, right? So your family had some involvement. What was key to the decision making? Can you tell me a little bit more about that?
So my mom came to the US before she was even married. So she settled in Chicago because that's where her family was. They were one of the first people to migrate to the US, and they all settled in Chicago just because it's a larger economy over there. Yeah. And completely different from what Kerala, our southern state in India, looks like, because it's warm and lush and tropical.
Oh my goodness.
So I always ask them, what brought you to Chicago? Why not Florida instead, you know? So it was just better job opportunities, right, for the first immigrants. And I just came because my mom and my family were settled there. So she brought me right to Chicago.
Okay. So you finished school and then you did your resume. And then I saw for a time you went back to India, right?
Yes. So I went back to India after I finished my residency.
Okay.
And so medical school is 4 years, residency is 3 years. And my mom is actually the one who told me, Marilyn, take a break. You've been just going back to back to back from high school to medical school to residency without a break. Oftentimes, many people do take an year off or something, and I didn't do that. I've always just been very much like a type A, goal-oriented, have to get to my goal kind of person. And my mom's like, look, before you enter the world of a practicing physician, you need to take a break.
Okay.
So that's where, as a family, we all decided to go to India. After residency, for 2 months, I was there. And I did a yoga teacher training in India, which was super intense, but I don't regret it. And I also got to learn my roots about Ayurveda a little bit further. And that inspired my goals as a physician even more, and really shaped and formed my holistic care as a physician further, because across from the yoga studio, there was an Ayurvedic hospital. So whatever came, like, that was the easiest place to access. It's unfortunate to say this, but many people don't really have too much faith in Ayurveda until you experience it. Even as Indians, they kind of just write it off as, oh, it's more natural. It takes a long time because it's not quick and easy like Western medicine. But that's why I myself hadn't experienced too much Ayurveda even at that point, other than some home remedies. But then I went to the Ayurvedic doctor, and he was able to help me through so many chronic issues I was facing, including gut issues.
Yeah.
And he finally helped me get off of my proton pump inhibitors, which we all take when there's acid reflux. That's like passing out candy. Everyone is on it. But after about, I would say, almost a decade of being on proton pump inhibitors, I finally came off of it with this help. And I still to this day stay off of it. And that's what I want to bring forth for my patients.
Yeah.
That healing from the root cause and addressing lifestyle factors and making healing sustainable.
I love hearing that. And that is special to me. My own household, we're in a place where those are our beliefs too, looking into our food, not just what we're eating, but sourcing where it's coming from, our health and fitness lifestyle, water intake. We talked briefly, we had a home birth this year, so we're very into that holistic thing as well. And let me first go back and commend your mom's advice, right? It sounds like, we started with my mom's advice was to take a little bit of rest, which I think we all need is some rest. And often you're right, we don't take, and then that led to, you finished that part of that conversation off with like, what's leading in my, what I care about most for my patients. And it's like, wow, like I feel a little bit of connection going from like the rest to like kind of reshaping your path a little bit and leading you to where you are today. And I've got your website pulled up here. If health is lost, everything else is lost. That's a quote you start kind of your bio on. It seems like you're talking about that right off the back. I like that. And I love hearing that. The yoga stuff is exciting. How does it fit into, is that something as a holistic approach, as you're looking into that, are they kind of tied together?
Yeah.
So instead of just prescribing a pill or prescribing a Band-Aid treatment, you're looking to go deeper and like, hey, maybe if you implemented this into your life, as well as like, if we need medication or whatever, now we can get the result we're really looking for.
When patients come to my practice, they are signing up for a whole new experience. We spend close to 1 to 1.5 hours during our new patient appointment. And oftentimes we are both standing up or stretching, doing exercises with the yoga mat, or laying on we have 2 tables in the patient room. So me and my patient, we may be laying there learning how to do what's called parasympathetic breathing, diaphragmatic breathing. And there are studies showing that doing the certain type of breath work with a certain ratio, that's parasympathetic breathing, it really helps to calm the nervous system down and promote the parasympathetic drive of the autonomic nervous system, thereby helping to slow down our heart rate, improving digestion, and helping with a state of anxiety that most of us are in.
Yeah. I like what you said there too. You're doing the activity with the patient, like right along with them.
Yep.
I've been to different, service providers, healthcare providers, all different kinds, where you're like, we're supposed to be centered around health, but I can just look at the whoever's prescribing it and be like, this person is very unhealthy, right? Or their lifestyle is very unhealthy. How can I even take this? So I do like hearing that, and it shows on your guys's, work that you do there. So let me talk about this. You kind of moved all over, and we'll talk a little bit more about the primary care, but what inspired you to establish the clinic here in Jacksonville, and what specific health needs of this city are you really addressing?
So when I moved to Florida from Chicago, we started off in Naples because we stayed in Fort Myers, but I practiced in Naples. My husband is from South Florida, and that's where he was at. And I really wanted to go to a place that had larger medical systems. I wanted to be surrounded by colleagues who were experts at their field. And that's what brought me to Jacksonville. Also, just patient population that cares about family. Because if you understand that concept, right, if you care about your family, then you will care about yourself, and you will want to stay healthy so that you can see your grandkids and your great grandkids if you're lucky enough.
Right.
And that brought me to Jacksonville because I really wanted to be surrounded by people who had that family value, and that in turn will translate to patients who care about their health. So over here, I'm really happy with what I'm seeing. The patient population is much more different than where I was in Chicago and South Florida. They are more aware of the future, their kids, and raising everybody right and setting a good role model. I really feel like addressing all of those health concerns are helpful. And Nate, what was the second part of your question?
The second part of the question was, what are the specific needs that you're addressing? So, you kind of talked about how there's a big patient population here, and there's people who care about their family, and while that's important, but these people that care about their family, these people that want to be around to see their grandkids grow up, like you mentioned, what are their specific health needs that you're addressing most for them?
So, what I notice here is there are a lot of holistic minded people and a lot of moms who want holistic options and raise their children in a very healthy manner. So I really am trying to reach out to those patients who are welcoming the integrative approach of both Western medicine and Eastern medicine together, because we shouldn't just be dismissive of everything that Western medicine has taught us. It helps save lives, but there is a time and place for everything. Just like we were talking about the gut issues, right? If somebody is having acid reflux, just throwing a pill at them may not be the best idea. We really have to delve further into their lifestyle, the stress, their sleep, and their diet. On the other hand, if somebody is coming to me with high blood pressure and their blood pressure is really high in the clinic, of course, we are going to talk about the parasympathetic breathing and yoga, relaxation techniques, sleep, everything else, but I do have to get their blood pressure under control, or they could end up in the emergency room.
Right.
So patients get the best of both worlds, both Eastern and Western medicine, when they come to me, and they have a physician who knows the time and place to use both the approaches in the safest manner.
Yeah. Yeah, I love hearing that too. And, that's something I kind of say a lot too. Thank God for like modern advances in medicine. We're at an amazing place for them. But also, do we need to get so carried away with it? Do we need to be on this? And when you're watching the ads, and I know a lot of times medical, we kind of tiptoe, like we don't want to get political or this or that. But like when the ads are shoved at you all the time and you're like, I'm like, wow, this is wild. And then there's certain things that are debated now where it's like, you can't grow that plant in your yard. And I'm like, hold on a second. Hold on. We can have this like $1 billion industry that's shoving drugs at us. And it's okay if we do it their way, but certain plant or whatever, you can't have it. It drives me nuts. So you like, a lot of holistic moms. There's a lot of holistic people here. I love hearing that because I know obviously my family's like that, and the people in my circle, my friend base are like that. But I often wonder, is that just because those are the 5 people I'm around every day that I'm noticing that I think that? But I believe that to be true. And you're kind of confirming that thought that the people of Jacksonville, we're really interested in a better way of life on the whole. And when it comes to health, that's part of it. Can you go? So those are some positives, right? But what about challenges? Since you've been here, since you've been in Jacksonville and you're promoting health and wellness, what are some challenges you've encountered here that you've had to maybe overcome?
Well, just like anywhere else, helping people understand why they should invest in their health. I feel like, especially with trying to get the younger crowd, it may be a little bit more challenging. I find that many people in their 20s and 30s, they are in school thinking about the future, but they may not understand the value of investing on average $100 on their health a month. Because they don't realize that concept of, yes, wealth is something and you're trying to build generational wealth and invest in your future, but health is wealth, which is my motto, which is what my grandfather passed down to me. They're not thinking about probably their family and their grandkids and their great-grandkids at that point. Yeah. They're just thinking about, oh, I'm sick, I'll just go to an urgent care. So helping the younger population understand the value of direct primary care, and then really getting to the small businesses, that's been a challenge too, helping people understand, look, if you're a small business, provide good care to your staff and your employees, because you don't want staff that are unhappy. People who are happy in their life would be happy at their work, and then you'll have better customer satisfaction and you'll run your business better. You'll have more loyal employees if you show that you care about their health. So if small businesses want to offer a direct primary care opportunity, we're talking about like their employees not having to take a day off because they had to go sit in an urgent care for 4 hours.
Yeah.
We're a phone call away. So selling the value of direct primary care has been hard because it is a newer concept. I wouldn't say it is just exclusive to Jacksonville. It is just a newer concept overall in the United States.
Right.
And helping those populations understand the value has been a little bit of a challenge.
Okay. I can see that. I can see where I know like I believe it's my generation, I'm a millennial, and I think we're on this quest for not just like get in line and do what you're told, but we're kind of right there in the middle where like, hey, we want the best outcome, but we want to kind of do the research and we want to see for ourselves, or we're not afraid to ask why. Right. And I think there's been an awakening with medical where like I see it in the older population, like my parents' population a lot, where it's just like, well, the doctor said, and it's like, well, did you look into that at all? Do you know what the ramifications of that are? Well, they know what's best, right? That was always the thing where with us, we're like, hold on a second, let me see something like, and it goes as deep, especially like the marketing is enough for us to question, like, why are they marketing it so hard? If it's like the bet, right? I don't know. It gets crazy. Let's talk a little bit more about that word. We call it DPC, direct primary care practice. And for the listener out there that is the first time hearing that phrase, can you kind of just explain the basics of what that means?
Yeah. So, to put it simply, direct primary care is concierge level medicine at a more affordable cost. You get a doctor in your pocket. Basically, patients create that approachability with the physician and direct access to their provider. And if it is an office like mine, they only see one provider. They don't get bounced around from one provider to another. So patients don't have to wait, and they get that more old school feel. They're part of a smaller practice, not one of 3,000 patients. They have a very quick access to any care that they need. Let's say, for example, last week, this actually happened. A patient of mine came back from a trip and she started having her asthma flare-up symptoms. And I was on my lunch break. I literally told her, come right in. Let me take a listen to you. She walked in. I just placed my stethoscope on her lungs. I'm like, you're wheezing. Here's what I'm going to do for you. And I also sent her home with some tea that I made.
That's great. So it's a more personal experience that may even cost less than, the average insurance. That's
exactly.
Great.
And it is true assurance of healthcare. Because if you think about it, right, affordable health assurance, getting insurance does not assure you good quality care or access to care.
Right.
Because if you're in a insurance-based system, you call your doctor up, right? The same scenario, that patient who came out of town, she could be calling them saying, hey, I don't feel well. I think my asthma is flared up. She might be scheduled out for 2 weeks.
Yeah.
And by then she may end up in the emergency room, right? So that is not assurance of access to care or quality care, because you can't guarantee what kind of care you're going to get in the ER. So she's definitely not going to get the tea that's going to help with all the mucus like she would in my clinic. And that is the difference. The personalization and true assurance of good care is what we promise our patients.
I love hearing that. And we've done something similar. We had the home doctor for pediatrician for the kids. And I know my wife will call and can text just a question, and they'll even like, it's not worth coming in, or like, let me come over, but they come to the house. And so we love that experience. So if anybody's looking for that, I would highly recommend get involved with that. And on the flip side, my personal experience, I'm a veteran. And so I've used the VA healthcare, and I don't want to be super harsh on them, but I want to make the comparison where literally today I was on the phone with them, and because they had my primary care in a different location, so we had to move, we moved physically houses. So I want to switch to a different office. And today, at the time of recording this, is September 16th. And the next available to come in to see the doctor for the first time is November 28th.
Wow.
You're talking like what is that? 2.5?
Yeah.
A month, 2 months, 2.5 months away.
Right.
And so hearing you say that, especially after being on the phone with them earlier today, I'm like, wow, that's amazing. And that's a great option for somebody looking to avoid that. That's something I was guaranteed. So it is what it is. But I love hearing that story. Let me see what else. I did want to talk a little bit more about the practice. And you already touched on it. I had this question ready. You said at Haven Family Health, we're not just another primary care, but we're a completely different experience. You've already dove into that a whole bunch, just like the story you just told. Is there anything else? What about the physical location? How does it vary? Is it just like a normal doctor's office, or is it is that part of the experience?
It is part of the experience.
Okay. Tell me a little bit more about it. I want to visualize like I'm walking into the office.
We actually just posted a reel on that today, which you should check out later. But when patients walk into our clinic, they should feel like they're at home. I want to immediately put them into a relaxed state, because it was my dream when I was a physician for my patients not to have white coat syndrome. Many people would walk in with high blood pressures, and they get a cold, sanitary condition where it's just medical equipment and medical literature everywhere. And that's not what you get at Haven Family Health. You walk in, you see it. There's like a diffuser going with essential oils. There are teas that I've hand curated, and patients walk in to colors of green and blue and teal. Yeah. And there's only a few chairs in the waiting area because patients don't have long wait times.
That's great.
And we have a chaise in my office if anybody needs to lay down. And in our patient room, it's a really large room. And we have artwork that's actually personalized by a nurse who's an artist. So there was a lot of intention that went into everything. We have live plants everywhere, and our patients really feel cozy. There's a lot of air, brightness, and light shining through everywhere. We don't have medical literature, text, or anything like that hung up on the wall. And plus, you'll find the pictures of my babies hanging on the walls.
Nice. Nice. It's like you're really carrying over those beliefs of your grandfather there, where you feel like family. So it's like you're coming to visit family versus, the lab.
Exactly.
I love hearing that. And it sounds almost like spa-like versus the medical. And I understand what you're saying. Anytime I've had to go to the medical world where, the charts on the walls, when you're just shoved in there, they always seem to be overbooked. You wait in the lobby forever. Then you go back to the back room. Then you wait there forever. Yeah. So this is a totally different experience. I know I'm personally going to have to come check it out.
Sure.
Let's talk a little bit more. Is there anything else that you want to touch on about Haven Family Health before we kind of maybe move on? I got a couple other questions I want to get into. Anything else?
I wanted to talk about, there is something, talking about Eastern medicine meets Western medicine, and having a holistic approach to healthcare. there's a lot of hype going on right now about medical weight loss medications like semaglutide and tirzepatide. And it worries me when people go to places that are probably not the best, or where it's just dispensed without proper monitoring. And I really wanted to put that word out there because they should be looking for a place that truly cares about their health and long-term sustainability of the weight loss, and also does lab monitoring. I mean, this is just like a public service announcement in a way too, because if you don't do it the right way, there are a lot of side effects. Plus, it's not just about the weight on the scale. That's not what people should care about. Right. They should care about truly like visceral fat.
What's going on with my body?
In the body. What is happening when I do have a lot of fat?
Yeah.
The insulin resistance that's created, the fat that's deposited around the organs. That is what can lead to heart attacks and diabetes and a lot of health problems down the road. Yeah. It shouldn't be just a matter of vanity and looking great. That's one aspect of it.
Sure.
But we want to lose weight for our health in a sustainable manner. And we want to do it in a safe manner because it does have a lot of side effects. Okay. So at our practice, we have one of the most holistic, comprehensive weight loss programs. We recently got the in-body scanner as well, so that people can get their body composition measured. It checks for what their basal metabolic rate is. So that way they know, oh, I have to hit this many calories in a day. That's how many calories my organs, my body, and my muscle needs to sustain itself. And if I eat less than that, I will be losing muscle. And that's where you hear that whole talk about, oh, people are losing muscle, not the weight, not the fat weight. That's because it's not getting done properly. So when people come to us, first of all, we check labs, we make sure everything looks okay. Then we start them on treatment. We closely monitor blood work every 3 to 6 months. Patients also get a lot of lifestyle counseling from me. We talk about how to eat to improve their gut health, to improve their digestion, how to overcome many barriers they may have, even emotional barriers they may have, to better lifestyle choices. And patients have constant access to me. I'm just a email, a text, portal message away. And we also check the body composition. We make sure and we monitor that they're not losing muscle. And then I actually do exercises with them during our follow-up visits to make sure that we are having exercises that are tailored to their lifestyle. For example,
to that individual. For example, I have a patient who is a car dealer. He's walking sometimes, but he's a manager, so he's sitting on the chair a lot. So we talked about, okay, what are things that you can do while you're at work? Because you have long work hours. Then I have a mom who's on this, who is a stay-at-home mom, but has like 4 kids. Yeah. And so her exercise is going to look different. And I showed her what she can do with her baby, with her infant, and how she can strengthen her upper body. So that's what I wanted people to understand. Like, if you want a comprehensive program, just think about where you're at, or look into a program like ours where you can really have good sustainable weight loss, because otherwise when you come off of these medications, the weight will just come right back. Yeah. And that makes so much sense and relatable to, even, believe it or not, to what I do. I'm a real estate broker. And what I often say is I'm going to walk through the process with you. Mm-hmm. And sure, there's a ton of other companies out there. There's a ton of resources. You could write a contract, get an attorney, write a contract yourself, do the whole process. But most people don't do it every day. They move every 5 to 7 years, maybe 3 to 5 years, depending on what their job looks like or something. So what I really do there, aside from the marketing side, the biggest piece that I think the biggest part of the value is holding their hand, walking through the process with them. And that's really what you just described to me as well. There's a ton of commercials for weight loss products, and that are both like natural and not natural, and a ton of data out there, but it can be overwhelming to come up with the right way. And it seems like what you're doing is you're giving them a clear view into what's really going on in their personal world, creating a customized system, and then walking through that process with them.
Exactly.
Which is incredible. And that's the essence of customer service, or building a relationship over a transaction, right? That's what I say a lot. We're relational, not transactional.
Exactly.
And
I love that.
I'm hearing the same thing in your world. It still applies. It seems like modern medicine can be very like transactional versus relational. And what you're really focusing on is the relationship itself, which is awesome As our city continues to grow, do you think there's any other pressing health issues? The weight loss is huge. I think that's important. Any other pressing issues that, Haven Family Health is looking to address in the coming years, in the future?
Yeah, I mean, there is a huge pressing issue going on right now, which is just the whole question of, if you have insurance, does that guarantee you good healthcare access? As you know, like Baptist is in negotiations with Blue Cross Blue Shield about whether to continue with them or not, and trying to get the reimbursement rates better. And so that just goes to show how unreliable access to good care can be, even if you have insurance. And I feel like many people have that false sense of security. Oh, I have health insurance, I'm good.
Yeah.
Yeah, you may be good. Like if you end up in a car accident and you need to go to the ER or something, but we're talking about different things. We're talking about preventive care. Are you truly getting good access to that? We're talking about if like a sinus infection comes up, or you get COVID, or you have diarrhea, or you have asthma flare up. Like, are you going to have to end up in the ER, or do you have a good primary care doctor who you can see? And are they even going to take your insurance in the first place is the question now, because Blue Cross Blue Shield is a huge carrier.
Are they in the right network?
I know.
Even if they take it.
Right.
Which is like
exactly.
the follow-up question, right?
Exactly. Now, if they're out of network, it's going to cost them an arm and a leg to go get access to one of the largest hospital systems in our area. So that is where direct primary care can come in, because I'm seeing this in all Facebook groups. Everyone's freaking out. They're like, should I opt in? Should I opt out of insurance because open enrollment is coming up?
Yeah.
And then the whole negotiation with Baptist and Blue Cross Blue Shield is going on.
True.
My only message to people is, why have anxiety over your healthcare when direct primary care exists? And I'm not just speaking for myself. There are many other colleagues of mine. And that's another thing. DPC doctors, we work together. We support each other. Unlike how it may be in the healthcare industry, but we actually have each other's back.
Wow.
And we share resources. We talk to each other. If a patient needs access and they're closer to another practice, we will advise them to go over there. And you will be coming into a whole new world of healthcare where the patient is the priority, nothing else. Wow. And whether they have insurance or not, Nate, they can still see a direct primary care doctor. So have insurance for emergencies, right?
Right.
For catastrophic stuff, but have a good direct primary care doctor who can live life with you, so that you can worry about other things and not about your health. So you can go to bed at night with peace and not be on Dr. Google, Googling how to diagnose your child's rash, but have that assurance. You can just portal message your direct primary care doctor, and you know that doctor will get back to you. That's how I am with my patients. I get back to them the same day or the next day. I hate keeping people waiting, especially when it comes to their health, because it creates a lot of anxiety. So just imagine a world like that. That's what I want for our community. As it keeps growing, this problem is going to become worse, because the current healthcare system is a sick care system. That's what I call it. Okay. They promote sick care. Why is that? The reimbursement rates are low. So the only way they can make enough money to sustain all the administrators and the middlemen and still pay the doctor is by seeing more people in a less amount of time. So they just keep seeing people without having the time to sit down with them and address the root cause of problems, how to prevent things, and how they can be more proactive about things, because that doesn't reimburse them. So they want to be able to see people in 10 minutes or less, prescribe a medication, get them going on their way, and see them back in more frequent periods. And that's just not convenient. So we need to talk about sustainable healthcare solutions for our community that's growing, which direct primary care is.
That's great. I love that. And you're right. And I've seen so much of that, whether it's on Twitter or other places. And I think this is part of the awakening that people are getting. I think this is why the ads have stepped up the marketing, because I think they realize maybe that people are starting to question this and start thinking about their health long term, start thinking preventive, start wondering like, wait, why do we have all these problems? Why are they promoting unhealthy things as being like, okay, if there weren't people that were starting to think the opposite, right? And so I think what we're doing today is really kind of reinforcing that. I love people like you are what I love about our city, honestly, because you're right. I think it exists here. I'm sure it exists in other cities, but maybe not all of them. free thought and questioning things. I think it's part of our city's nature. It moves at a little bit slower pace. It's a little more southern, right? Even though we're the northern city, people have come on here and we've talked about that. And so when you talk about family and you talk about the need for creating a good future, I think Jacksonville, sometimes to a fault, local leaders are thinking about the future. Sometimes that means they're very slow to make decisions or to put things in place. And we're like, come on, get it done already. But I think the root of that is really like, hey, let's really think about the future. So we need more people like you in it for sure to have a positive outlook. Man, I think we probably have reached our time limit, if not gone over, but I'm sure it was enjoyable for the listeners. I know it was for me, and I'm like, we could have this discussion maybe like quarterly and see some updates, but thank you so much for coming on. For the listener out there who wants to get in touch with you or maybe wants to get connected with Haven Family Health, what's the best way for them to take that step?
They can go to havenfamilyhealth.com or give us a call at 904-902-0150. And me or one of my staff will get back to them.
Awesome. I love hearing that. We'll be sure to put the website and the phone number in the show notes below. And Dr. James, thank you so much for coming on, spending some time with us today. And as always, thanks for listening to This is Jax.
Of course. This was fun. Thank you for having me.
We'll do it again.